It's 2 a.m. in the emergency room. A 7-year-old child rushed in with high fever, vomiting, and now seizures. The parents are terrified. Within minutes, the child becomes unconscious. Hello viewers, this is not just a fever. This could be something more dangerous. I am Dr. Mukib, presenting you with another video on Acute Encephalitis Syndrome, a deadly brain emergency that can kill within hours if not recognized early. Watch till the end for complete understanding. Let's begin. Now let's understand what is Acute Encephalitis Syndrome. So AES is clinical syndrome characterized by acute onset of fever, altered mental status like confusion, disorientation, coma, seizures which is newly onset, and sometimes it may also include behavioral changes, focal neurological deficit, raised intracranial pressure. Acute encephalitis syndrome is not a single disease but a syndrome caused by multiple infectious or non-infectious conditions affecting the brain. Let's talk about the epidemiology of the AES. Acute encephalitis syndrome is common in South and Southeast Asia, especially in countries like India, Nepal, and Bangladesh. In India, large outbreaks have occurred in Uttar Pradesh, Bihar, and Assam. And the peak season for the outbreak of acute encephalitis syndrome is like monsoon and post-monsoon. It's in between like June to October. And the most common affected group for acute encephalitis syndrome are children. Now, what are the causes of acute encephalitis syndrome? Acute encephalitis syndrome can be divided into infectious and non-infectious causes. So the most common cause is viral cause, and the most important viruses include the most important virus, that is Japanese Encephalitis virus, most common in India. Then second most virus is herpes simplex virus. Third, enterovirus. Fourth, dengue virus. Fifth, Chandipura virus. Fifth, Nipah virus. And the last one is like varicella zoster virus. And there are other causes that may also cause acute encephalitis syndrome, like bacterial causes. The bacterial causes for acute encephalitis syndrome are like Streptococcus pneumoniae, Neisseria meningitis, that is responsible for meningococcal acute encephalitis syndrome, then Mycobacterium tuberculosis, Leptospira, and Rickettsia. Some parasites may also cause acute encephalitis syndrome. The most common parasite that is responsible for acute encephalitis syndrome is like Plasmodium falciparum, that cause cerebral malaria. And another one parasite that is responsible for acute encephalitis syndrome is like Toxoplasma gondii. And the non-infectious causes for acute encephalitis syndrome are like autoimmune encephalitis, toxic encephalopathy, metabolic encephalopathy, heat stroke, and one more common cause of non-infectious acute encephalitis syndrome is like hypoglycemia. Let's talk about the pathophysiology of acute encephalitis syndrome. The basic mechanism involves in acute encephalitis syndrome is like infection or inflammation of brain tissue first occurs, then that causes neuronal damage, that causes cerebral edema. As there is cerebral edema, it increases the intracranial pressure, and where the intracranial pressure increases, that leads to seizure, altered consciousness, and neurological deficits. Let's understand the clinical features for acute encephalitis syndrome. So there are some early symptoms for acute encephalitis syndrome. So early symptoms include fever, headache, vomiting, malaise, neurological symptoms like altered sensorium, confusion, irritability, seizures, neck stiffness or neck rigidity, photophobia, and some severe symptoms includes coma, focal neurological deficit, respiratory failure, and raised intracranial pressure. So what are the investigations to be done in a suspected case of acute encephalitis syndrome? So in blood test, we have to go for complete blood count, CBC, blood glucose, electrolytes, liver function test, renal function test, and blood culture test. And one more important investigations to be done in acute encephalitis syndrome is like CSF analysis, cerebrospinal fluid analysis. By doing the lumbar puncture, we collect the CSF fluid and then we send it for analysis. And the tests that we usually do in CSF are like The opening pressure, we have to check the cell count, the protein count, the glucose, and for CSF gram stain, culture, and PCR for diagnosis of viral infection like Japanese Encephalitis virus and HSV virus. So there are some other important tests in CSF to be done is like I already told, like Japanese Encephalitis IgM ELISA test, HSV PCR test, and the typical finding in the cerebrospinal fluid analysis in viral acute encephalitis syndrome are like the cells will be lymphocytic paleocytosis, and the protein will be mildly increased, and the glucose will be just like normal. And about the neuroimaging, so in neuroimaging we have to do MRI brain and CT scan of the brain. And in herpes simplex virus infection, there will be lesions over the temporal lobe. In this treatment, there will be lesions over the temporal lobe of the brain. And in Japanese encephalitis, there will be lesions over the thalamus. That means there will be thalamic lesions. Let's talk about the management of acute encephalitis syndrome. So acute encephalitis syndrome management is primarily supportive with early empiric therapy. Like emergency stabilization, we have to approach with ABC. Like first we have to protect the airway, then we have to give oxygen, we have to make sure to access the IV line, and we have to control the seizures. And to control the seizures, we usually give like injection lorazepam, injection diazepam, or injection levetiracetam. And next come to the empirical treatment, because the exact cause is often unknown. So initially we used to start with antiviral therapy for suspected case of herpes simplex virus encephalitis with injection acyclovir. Usually we give it like in 8 hourly. And for bacterial coverage, we used to give like injection ceftriaxone and injection vancomycin. So let's talk about the management of rest ICP. So in acute encephalitis syndrome, there will be rest intracranial pressure, and to decrease the intracranial pressure, first and foremost we have to keep the head end elevated. The head end should be elevated. We should start with mannitol and hypertonic slide. Let's talk about the supportive ICU care. So we may have to start with mechanical ventilation if required. If the patient's GCS is low, or if the patient is not able to breathe properly, we may have to intubate the patient and put on the mechanical ventilator. We have to give IV fluids. We have to correct the electrolytes, and also we have to give the nutritional support if possible via RT tube, and if no, it's not possible, then have to go for total parenteral nutrition. And one more thing, make sure to check the random blood glucose level at least every 4 to 6 hours, because hypoglycemia is a most common complications of acute encephalitis syndrome. Let's talk about the complications of acute encephalitis syndrome. So there may be persistent seizures, there will be cerebral edema, there may be respiratory failure, there may be permanent neurological deficits, or there may be death of the patient. And the mortality rate may reach up to 20 to 30% depending on the cause of the acute encephalitis syndrome. Now, how will you prevent acute encephalitis syndrome? The first and foremost, we have to go for vaccination. Vaccination for some viruses like Japanese encephalitis vaccine. We have to control the vector. We have to control mosquito. We have to use bed nets. And we have to take some public health measures: early diagnosis, surveillance, and health education. So for exam purpose or clinical purpose, always remember acute encephalitis syndrome is fever plus altered mental status. There may be or may not be plus minus seizures, and most common cause in India is Japanese encephalitis. So if you are practicing in India and if you get a patient with acute encephalitis syndrome, never ever forget to screen the Japanese encephalitis. And third, we have to do CSF plus MRI plus serology confirm to diagnose the case, and start with antiviral therapy like acyclovir early if suspected viral encephalitis. And ICU support care is critical. As doctors, our job is not only to treat disease, but also to recognize it early. And when it comes to acute encephalitis syndrome, early action can save the brain and save a life. I hope you like the video. Kindly do me a favor, by like, share and subscribe to my channel. And don't forget to click the bell icon to get notifications on my new video. Thank you so much. Thanks for watching.